Hello, my name is Caress Perkins, and I will be performing the Foley insertion checkup checklist. First, I will start off by um, checking the patient's chart and then looking for the provider's order. Then I will check the medical record to make sure there isn't anything that will be that will hinder the process of the Foley procedure. After that, I will go and collect everything that I need for my procedure, for the procedure for the patient. After that, I will knock on the patient's door, introduce myself, provide privacy, wash my hands, and check two patient identifiers. After that, I will go on to explain the provider's order for the Foley, and then I will go on to explain the insertion process and how the procedure goes. Soon after that, I will answer any questions the patient has for me. And after that is done, I will lay the patient flat to their comfort level, and then I will bring the bed up to me, to my waist, at a comfortable level for myself to be able to perform the procedure. After that, I will have the patient bend their knees and open their legs. I will also let the side rail down on the side that I'll be working on. And then I will perform hand hygiene and put on gloves. And I will have soap and water. And I will begin to wash the penis, starting at the head of the penis, the meatus, starting there and washing circular motion outward to the head base, the base of the penis, with soap and water. And then I will begin to wash the shaft of the penis, starting from the base of the head of the penis down to the base of the shaft. So I will be washing downward with soap and water and towel. And then I will wash and rinse my towel and begin to wash the testicles. And then after that, I will dry the penis off with a dry towel. And then I will put away to the side the things that I use to wash the patient's penis. Okay, and after that, I will perform hand hygiene, and then I will begin to set up my Foley kit. Okay. All right, so I will begin to take everything out and set up. Okay. So I will use this bag here as like a trash bag. That I can use. And then I have a 1-inch border that I can touch to open up the Foley kit. And then I have a 1-inch border for the pad. That will be my sterile field. And I have to lay it down on the plastic side, facing down. Okay. And then I have the penetrated pad that goes over the penis. And I have a 1-inch border on this as well, around. And this goes over the penis. Okay. All right. After that, I have to put on my sterile gloves. And I have a 1-inch border on this as well. and I can't touch anything past that 1-inch border, and I cannot turn my back on my sterile field. So I use my 4 fingers to go into the pocket of the gloves, and I will put my gloves on that way. And I can't touch anything else outside of the gloves. Okay, I'll do the same for this one. Okay, and I must keep my gloves above my waist. I cannot touch myself or anything that's outside of my sterile field. After that, I will take the tray and set it on its own sterile field. And after that, I will take the Foley out. Okay, like so. And I would get the alcohol swab. I will tear it open, go out and around, dispose of it, and I will take the swabs out. And I will set it in its own area for the tray. Go out and around, dispose of it. After that, I will take the tops off of my syringes. This is my sterile water that will be used to inflate the balloon. I'll go out and around, set it back, and then I have my sterile lubrication lube that I'll use. Take the top off, go out and around. Okay. All right. So after that, I will take the plastic off of the Foley line. All this is still sterile. And I will use this, go out and around, dispose of it. And after that, I would, I have my dominant hand and my non-dominant hand. I have to keep this hand clean. This hand will be dirty. So at this time, I will hook my saline sterile water onto the Foley line. Okay. And after that, I will get my lube. Actually, I will get my swabs, and I will use this hand to basically hold the penis in place, and I will not be able to touch anything else in my sterile field with this hand. I won't even be able to let go of the penis at this time. So now I'm going to begin to wash, sterile the penis with my swabs. So I'll start at the meatus, circular motion around the penis head, go out and around, dispose of it. I'll do it again, starting at the meatus, out and around, dispose of it. And then I'll do it again, meatus, out and around, dispose of it. Okay. After that, I will get my sterile lube, and I will insert this into the urethra, all of it. Okay. And then I'll go all out and around, dispose of it. And after that, I will insert the Foley line. And at this time, I will basically let my patient know to take deep breaths and to bear down. And if there's anything that makes it complicated to insert the Foley line, I will stop the procedure immediately and figure out what's going on. So at this time, I will insert the Foley line until I get a urine return. Okay, and you got to make sure not to touch anything with this hand, the penis or anything. You got to keep it sterile. And after that, I will use my balloon. Sterile water to inflate the balloon inside. And I'm going to use all of the water in here, the whole 10 cc's. Okay. Then I'm going to unhook it, go out and around, dispose of it. Okay. And then I'm going to pull it out slowly until I can't anymore. Okay. All right. So it's in properly. And then I will use, this hand is still dirty. I will use, it's an adhesive sticker that you hook onto this, and it'll stick onto the adhesive part will stick onto the thigh of the patient. You want to make sure you have some room with the Foley line so the patient won't pull it, cause themselves to bleed out or anything like that. But you want to hook this on to that piece that sticks onto the thigh so it can stay in place. And after I do that, I will get the Foley bag and I will place it on the side of the bed below the bladder. Put it on the bed so the flow with gravity, it will come down into the Foley bag. After that, I will tear the fenestrate pad over the penis, and that's how I'll take that off. And then I will get rid of everything else that's between the patient's legs. And then I will cover the patient up. Make sure they're comfortable, make sure everything feels okay to them. And then I will lift the patient head up to a comfortable level for themselves. And I'll bring the bed back down to a safety level. And I will basically let them know that if they need anything, they just have to push the call light. Need help with anything, push the call light. Me, myself, or someone on the floor will be in as soon as possible to help them. And I would ask if they want the lights on or off, and the door closed or open. And I would, by that time, I would have been performed hand hygiene, and walk back out into the hall to finish my workly duties. And that will be it for my Foley insertion check off. Thank you.